My name's Adrian and I'm the patient representative on the Nuclear Medicine Society. And today I'm talking to Alan, who's a patient who's experienced prostate cancer and is in fact now in remission and is looking to share with us his experience of cancer as it's come to him and also his treatment he's had. So Alan, introduce yourself to us, would you? And off we go.
Okay. Good morning. Hi, my name is Alan Lewis. I'm 62, almost 63 in next couple of weeks. I live in Warsaw in the West Midlands. And in March of 2020, I found out that I had prostate cancer. And the reason why how I found out was the fact that I was a very fit person. I used to go running, do 5-mile run, 10-mile run, go to the gym 3 or 4 times a week. And I used to start experiencing a lot of back pains and chronic back pains. But I used to put it down to the fact that I was going to the gym and it was just a process of just, overexerting myself. So, but on this one particular occasion, I was going for a run and I had severe back pains. I couldn't even run. And I thought to myself, this is something wrong here. I need to explore this a bit more. So I booked an appointment with the doctor, explained what's going on. He's done some blood tests and nothing came back positive, but I still experienced a lot more pain. So I went back again. He'd done some more tests and then he phoned me to say that I need to go to the hospital. So, I went there to the hospital. Saw the consultant and he explained to me that I've got prostate cancer. That came as a bit of a shock to me because being a fit person, I never expected anything like that in my life, to be honest. And he told me at the same time that my PSA level at the time was 2,400, which basically was extremely high, and I shouldn't really be standing or be alive, to be honest, how high my PSA level was. So obviously that was a bit of a shock and, disturbing and quite upsetting at the time. And he said to me that they actually needed to start a treatment on me straight away. So they gave me 2 hormone injections into my stomach. And from there, they decided that they needed to do some more treatment. So before that, actually, I went and had MRI scan done and a CT scan done to find out the extent of my cancer. And the result came out that the cancer had moved from my prostate and it had gone into my bone. That's why I was experiencing so much problem with my back and my hip and my side. So they decided they needed to do some radiotherapy. So I'd done a week of radiotherapy. And from there, I'd done another scan and they found out that the extent of the cancer was still pretty extensive. So they decided I needed a course of chemotherapy, which I'd done a 10-month chemotherapy, which was really, really excruciating. It was really hard to do, really, because it sort of really affected my health. My diet, I couldn't eat. I was being sick. I was not well. I've lost a lot of weight from the chemotherapy, but I managed to get through the 10 months of chemotherapy, and from there, I had another course of radiotherapy. And in the meantime, I was experiencing a lot of pains in my back, still in my vertebra. So that's where the main part of the cancer was as well, in my T5 and my T6 vertebra. So that was causing me a lot of excruciating pain. And then I found out that I was getting a lot of spinal compression on my back through the cancer because it was in my back. So I went to the orthopedic hospital in Oswestry. And the consultant, after having a scan, the consultant decided that I need to have a back operation. Because if I didn't have a back operation, I could end up being paralyzed. So I had a 5-hour operation on my back. And I stayed in hospital for about a week there. I came out, and then I tried another course of radiotherapy for another 5 days worth of radiotherapy. And from there, I spoke to my consultant, and the next course of treatment was, he mentioned to me about radion therapy, and he asked me if I knew what that was, and I explained I didn't know what it was. So I explained what it was. It's your body's targeted with radioactive treatment, which is intravenously into your body, and it targeted the cancer cells in your bone. And he asked me if I was interested in that treatment, and I wasn't sure at first, to be honest, because but I thought to myself, well, I've got nothing to lose, because I was in so much pain and I've went through so much of a treatment, and I thought, well, I'll give it a go. So I had 6 treatments every month for 6 months, and the first treatment that I had, considering I was still in a lot of pain before I had the treatment, I had the first treatment. And after about two weeks or so of having the treatment, I've noticed a lot of difference in the way I felt, in the way I walked. You know what I mean? The pain was starting to get easier from having that treatment. And after the 4 weeks of having the treatment, everything started to seem a lot easier. My movement, the pain wasn't as intense as it was before. And as the treatment continued, I've noticed that I was starting to feel a lot better in myself. My appetite started coming back, and I started to move around more. I started to walk a lot longer, and there was no side effects from the treatment at all. I didn't felt any side effect. I didn't feel sick. I didn't feel any nausea or any diarrhea or anything like that. There's no side effect I find from having the treatment. Yeah. So and after the 6th treatment, which I had the last one on the 26th of January, I seem to got my life back from having the treatment. I could do everything. I could go back to the gym. I could walk longer. I could do more than I've ever done in the last 5 years. I've been diagnosed with the cancer.
Right, so that's brilliant news from your perspective, then, isn't it? Your life has been regained from where you were even a year ago. I think you said your back operation was April 2024, wasn't it?
Yeah.
Earlier. So up until that point, and even thereafter, you were still taking quite a number of painkillers because you had the pains. It's still down in your hips and around your groin. Is that correct?
Yes, it was. Yes. I was taking strong painkillers. For the pain, because the pain was still there before I started the radion therapy. So that was the only way I could actually relieve the pain. Right. Because, you know what I mean? And it was a bit of a concern, because I thought, am I ever going to be pain-free at all? This is how my life's going to be now. Yeah. You know what I mean? Because, obviously, because the cancer's in my bone, and then my movement wasn't very good at all before I started the treatment.
So who explained to you what the treatment actually involved? Was it your consultant? Was it the radiographer at the hospital? Who was it who managed to allay your fears about coming out sort of glowing in the dark? Because then, who helped you on that journey?
Yeah, well, it was my consultant, Dr. Sawyer at the New Cross Hospital. He sat down, we spoke for about an hour and a half, and he actually explained the treatment, where the treatment was from. I think it was either from Belgium or Holland that the treatment was coming from. And actually he asked me about if I actually knew about the treatment, which I didn't. So he explained the treatment, how it worked, and what it did, the side effects from the treatment. And he did say that the side effect doesn't really affect everybody, you know what I mean, but the side effect can affect some patients. It all depends and how physically fit the person or the patient is at the time. And because I was quite a physical fit person from the time, so maybe that's the reason why I think that I never felt, any of the side effects from having the treatment.
So he explained to you that you need to go in for this. And when you went for your sessions to get the injection, was it a quick put it in your arm injection, off you go? It wasn't sitting around like chemotherapy for hours at a time while it dripped in or anything like that then?
No, it wasn't actually. Actually, when we went in there, the nurse at the time, she explained the treatment to me. She said, "This is what we're going to do. We're going to put an intravenous drip into your arm, and then we're going to administer the radion therapy." She says, "There's no side effects. You shouldn't feel any side effects. You don't have to stay in hospital long. Once you get it, that's it. You're out." The only thing she explained to me was that you must keep away from pregnant women or babies, because obviously your body's radioactive for a few, so at least for 4 days, not to be around pregnant ladies or little babies. And also my hygiene had to be different, like going to the toilet, making sure that you sit down if you can in the toilet, or you use antiseptic wipes if you go into the toilet as well, and washing your hands every time you go to the toilet as well, because obviously you're just spreading the radioactive thing around the toilet as well, and so which I actually did.
So your perspective, this radium therapy you've had has been the one thing that's made the mega difference to your pain, your mobility and things like that. And I think the consultant explained to you it's not exactly cheap, is it? The actual cost of this treatment.
No, it wasn't actually. I mean, to be honest, right, I honestly say, without this treatment, I don't think my mobility would have been as good as it is now. And I know the treatment is expensive, because one treatment costs £6,000. So it's quite an expensive treatment. So in my mind, I used to think, well, if it costs £6,000, then obviously it must work somewhere, because it's a very expensive treatment. So, and that was one of my positive thinking as well, to go ahead with the treatment as well, because I thought they're not going to give you a treatment and pay so much money for a treatment which doesn't work. Yeah. So that's one of the reasons why I thought, yes, I would give it a go as well.
And then, of course, that makes it even more important that you turn up for your appointments, doesn't it? Because the actual radium effectiveness is very short term. So it's ordered in for you, and you've got to be there on the day to get it administered, because you can't sort of suddenly decide not to go or anything like that, can you? It's important you turn up on the day as arranged. Yeah.
Yes, it was. Yeah, because obviously, like I said, it's every 4 to 5 weeks. One thing I must say, which I did forgot to say, is that before every radium treatment that I had to go and have a blood test done before, so they could see what my levels were and how it's affecting myself. And every time I went and had a blood test done, all the results was very positive from there. And so once a blood test is done, then the week after that, I think the blood test would have been done like every 4 weeks. And then in the 5th week, I would get an appointment to come in and have the radon therapy done. Because the radon therapy, the treatment itself was coming from abroad, and it had to be ordered in. So it wasn't actually made in the UK. It had to come from abroad. I think it said out of Belgium or Holland. So once it comes in, then yes, I had to be there on time to have my treatment done. I couldn't miss an appointment at all. Right. So that was, so I was, and because the treatment was working for me, it gave me incentive all the time to be there to have it done.
Yeah. And I think you said to me before we started, your PSA levels down now to about just over 100 or something like that, which you agree is still high, but compared to 2,500, it's a lot better.
Yes, it was. Yes, consider, because I said 2,500 was, as I say, I shouldn't have been around, to be honest, or how high it was. But with all the treatment that I've had, it has brought it down. It's still high, and obviously I would have loved it to be a normal PSA, would have been like 4 or below, but obviously I don't think I'm ever going to get down to that level again. Yeah. I don't think so. But it's manageable, and it's not affecting my life as such.
Are you still on hormone treatment then, Alan, or not?
Yes, I'm on hormone treatment. I'm on Zoladex injection, which I have every 3 months.
Right.
Because the reason I'm having the Zoladex is that because the cancer is still about in my body, and the cancer cells, it feeds off high hormones and high testosterone level. So what they're trying to do is control my hormone level and control my testosterone level, so they keep it at a low rate.
Right.
You know what I mean? So because obviously the higher it is, the more the cancer's gonna and obviously the cancer is not, it hasn't spread to any of my organs.
Right.
It's just, you know, in my bone at the moment, but on a low level.
So are you expecting to go back for any more CT scans or MRI scans to check the way the cancer hasn't spread or anything like that?
Yes, I am. I've got an appointment. At the moment, since my last radon therapy, I've got a my next appointment with my consultant is in May. So at the moment, I've got a bit of a grace at the moment where I don't have no treatment at the moment,
Yeah.
and I've got an appointment with a consultant to see what's next, what's the next step with my treatment, because the reason they gave me so long a treatment is because the way I've reacted to the radon therapy, you know what I mean, and because I'm not experiencing any form of pain or anything at all at the moment from the treatment, then they thought, well, we just give you a bit of a time just to your body to sort of relax really before it starts again, before they start the next lot of treatment.
Yeah. So I mean, from what you've been told so far, is another course of radiant treatment a possibility, or is the sixth that's it, or don't you know?
I don't know. In my eyes, you know what I mean, I would love to be able to have another course of radon therapy because I think it works for me. You know what I mean? Because obviously, I don't know whether they'll be able to do it again because of the funding, because it's a lot of money. So that's one of the reasons. That's one of the things I'll have to speak to the consultant about. Can they continue with this treatment, or would they have to go and look at another a next lot of treatment for me to have? You know what I mean? So that's the question I need to ask.
Right. So that's your first of many questions when you turn up in May. Then is it?
Yeah.
Quite a few of those there. And so in the meanwhile, it's keeping on with the injections and hoping the level keeps dropping and you keep as active as you possibly can do. Yeah. That
is my plan. And I think, as I said, because you know what I mean, as I said in the beginning, I'm a fit person, but you know, I'm not as fit as I used to, because obviously as you're getting older, you're not as fit as you are. But you know what I mean, but I am very active still, and I mean, and it's all because of this radion therapy that I had.
Right.
You know what I mean, that's actually, you know what I mean, it's gave me back my mobility, my quality of life again, you know, that I lost for quite a long time.
Right.
You know what I mean? So, and it's and yes, I feel very confident in myself, whereas before I lost all my confidence. Because you know what I mean, I was basically struggling.
Yeah.
You know what I mean? And with I mean, the fact that knowing that I've got cancer, knowing that the fact I was in a lot of pain, and I thought there was no way out from what was going on until I started the treatment.
Right. So you've been going for some 2020 to 2024 with various chemotherapies, radiotherapies, your back operation and things like that. But it wasn't really until you started this radium treatment back end of last year that you really got this mega improvement. Once the pain has disappeared and you can start moving around again, it's almost like sort of self-curing, isn't it? Because you feel so much more secure in yourself, I suppose, then.
Yes, I did. You know what I mean? So as I say, from the first treatment until the last, you know what I mean, there was never no sort of no pain, no it's just, I felt as if I didn't have anything wrong with me. Right. I felt like I was just how I was before I found out I had cancer. Yeah. So and that's the reason why I could have done all the stuff that I do now, you know what I mean, because I'm pain free. You know what I mean, I could eat properly again, where before I couldn't do anything. And I mean, I'm less stressed about a lot of things because my stress level was very high, and I had a lot of uncertainty about life itself, my future. You know what I mean, how it's going to play out in the end. You know, and yes, I had a lot of support from my friends and my family because they're very supportive and they was always there for me. Yeah. But sometimes, you know, when you're going through stuff at the time, even though you got the support from friends and family, you're still going through it yourself. And it's very difficult, you know, because it's very difficult knowing that you're going through something. Even though you got people understand what you're going through, they're not experiencing what you're going through. So for me, that was a very big thing to having to deal with at the time. Knowing that I've got this cancer in my body, which I didn't want, I didn't ask for, but it's there. And I'm not blaming anybody for it, because it happens to a lot of people. Yeah. And I know that that there's a lot of people who are in a worse position than myself. And so I was grateful for the treatment that I've had or had from day one when I found out in 2020 that I had cancer. Up until this day, I was never left behind by the NHS. They always looked after me, always appointments, always treatments all the way through. So I'm grateful for that.
Well, that's brilliant. And do you have a family, Alan? I didn't ask you to start with. You got a family?
Yes, I have. I've got 4 children. I've got 3 boys and a girl. My 2 older boys are 38 and 37, and they're married with children. And my daughter's 23. My son's 19 just this year. So right. Yes, yeah, I've got my kids, and they're very supportive, and they're always there for me. So yeah, So we're very close. All my family and my brothers and sisters as well.
Right. So. Yeah. That group around you is really, really important as well then. And having the grandchildren is another reason to make sure you're there for longer, isn't it? A really good reason to fight on and make sure you do the best for everybody. Yeah.
Yes, because I've got 7 grandchildren as well, and they're always around here. My house is always busy. My place, the kids are around, and it is nice. It's nice knowing that your family, they're always there for you. They're very supportive. And they put you in check sometimes, because sometimes you think you want to do more than you should, and they'll just put you down and say, no, just calm down a bit, just take it easy a bit, I know you feel better in yourself. I know you want to do more, but just remember, you're not that person that you was 4 or 5 years ago, So, which is a good thing as well, really, to be having that support as well from them,
Well, Alan, that's been great talking to you. Thanks for sharing your experience with us. And we'll be putting this on our website so that other people can learn from what you've gone through, get that positive feeling about it, overcome that original anxiety that you have when someone says it's going to be radioactive at the end of the day.
Yeah.
Acknowledge that the benefit you've had from it is actually way more important than the anxieties you might have felt when it was first suggested. And the fact that it's been such a positive treatment for you with this radium treatment is a good, I think from our perspective, is one of the reasons we're really trying to push these nuclear medicine treatments, because they are effective. They are expensive, but they're very effective. And if it gives you your life back and enables you to be more active and outgoing and things like that, it's a good investment from the health authorities' point of view. Otherwise, you'd just be sort of slowly vegetating. That's a cost in that as well. So the fact that you're up and about and doing things is really beneficial for you, your family, and for the country as a whole, isn't it? No doubt.
Yes, definitely.
So,
definitely, yeah. And actually, as I say, I really appreciate the fact that I had the opportunity to be offered this treatment, and because obviously I know that it's not everyone is offered this treatment at all because of the expense of this treatment, So I am really grateful for it, because I said before, it's actually gave me my life back by having this treatment. So, and I hope that there's people out there or patients out there who could experience what I've been through, and what the treatment has done for me, and hopefully they get the opportunity to have the same treatment as well.
That's splendid. Well, thanks very much for your time, Alan, and
thank
you continue to be active well into your 70s, like I am.
Yes, thank you so much.
I'm well on at the moment myself.
You're looking good. Thank you.
Thank you very much. Bye.
Okay. Cheers. Bye.